Welcome to the 8 Minute Rule podcast, where actual physical therapists share clinical pearls designed to create conversation around what's getting results in the clinic. No fluff, no Medicare stopwatch, only quality content. Welcome back to the 8 Minute Rule. I got Drew and Mark with me here today as we are going to be talking over soft skills. But before we go there, let's get a quick little icebreaker to you guys. So another fun one that may or may not have a great answer. What was the last concert that you went to? Mark.
All right, Jordan, here you go. I've never been to an in-person concert.
I think my goal is to continue to find icebreakers that Mark does not have an answer to. This is wonderful. You've never... Well, so not in person. Was there a virtual concert over the COVID days that you experienced?
Not that it's paid for, but I've watched some concerts or brief excerpts of concerts or other things, like just videos.
All right, Drew, man from a different generation, more like mine. What was the last concert that you went to?
I think it's been a while, but I'm pretty sure my last one was Cody Jinks.
I think my
It
last
was in
one
Raleigh, in your area.
Yeah. I think my last was actually Luke Combs, just coming out of COVID. So it was a nice little. It was a good time. It was a lot of fun. So good to hear. All right, so transitioning over, one of the main things we want to look at, and most people have some pretty good stances on drivers of healthcare. The typical research kind of breaks it down. Again, you can find a lot of different sources here, but the main drivers in healthcare outcomes in the clinical setting being clinician competence, communication, patient-centered care, cooperation, and kind of the organization's environment to some degree. So obviously those are a lot of broad stances here, and most of them make sense. But when we're driving on clinician competence and communication, really what has my attention today is just thinking about the soft skills. And so what I'd love to pick you guys' brains on is you guys are excellent clinicians. You've been doing this for a while. You've learned the skills across the board, but you've also really worked on a lot of your soft skills over the years as well too. And so, especially when thinking through how you treated as a new grad versus how you treat now, just give me some feedback on thoughts you may have. How are you connecting now differently than you probably did when you were a new grad? I'll let you start off for us, Drew.
You told me this a little bit ago, and I was thinking about, what is the biggest difference? I really think one of the biggest differences is trying to get patient perspective and trying to find what their beliefs are. Before, when you first come out, you think, oh, you know a lot of things, you're going to tell them exactly how it should be. But when you start to ask what the beliefs are, that's when you can actually start to change habits, lifestyles, and things like that, which is a huge piece of what we do, at least in my practice. A lot of the patients that I see have lack of healthy behavior disease, as I've heard it called. And unless you get behind some of the beliefs, they're probably not going to make a major change, because most people know what they should do in order to be a little bit healthier, but they don't really have a good way of going about it. And if you can help shape their beliefs and come alongside them, it's going to make it a whole lot easier. So that's probably the biggest thing that I've changed in the soft skills, is just asking them, what do you think is going on? Why do you think this? Getting more of their perspective around what they think that they need as well.
Yeah, I love that. The whole mindset of, coming beside the patient, you're standing beside them as opposed to across from them, really giving them a lot of accountability and autonomy in their care too, which is really cool. So good stuff. How about you, Mark?
Yeah, I think becoming more proficient with the 4 Habits model. I mean, to Drew's point, eliciting patient perspective is part of that. But so I won't touch too much on that. But going to a different direction is just the little subtle things that can make the difference between an outstanding experience and just a good experience. So if I'm going to get a patient from the waiting room, for the first time, the smile, the handshake, those small things can make a big difference. The walking them back up to the desk when they're done with their evaluation, they're done with their appointment. What other medical provider, what other doctor actually does that? We're fortunate that we can have the bandwidth to do that, and it's small things like that that can really make the difference. It's when I'm taking a subjective examination with a patient and they tell me about their grandkids or their kids or something. You know, I see a lot of patients. I don't necessarily have to remember that for every single one of my patients, but making a little note that next time I go in and I'm seeing that patient, like, you know, they've got their kids, they're doing this, like setting myself up for success in future appointments by taking those notes, I think is a nice touch that patients really do appreciate, and it matters.
I think in that four habits model, and one of the things you mentioned, there's 2 points that I tend to try and do. The kind of some sort of an empathetic statement. You know, if they're having difficulty with, you know, their kids, like, oh, that sounds like it's difficult. Sounds like it means a lot to you. And they can maybe even go a little bit down that path to tell you a little bit more about it. That will, one, help you remember it. And then two, it's going to help that therapeutic alliance as well. And then there was another piece that remembering certain things that I think it was a blog from Larry Benz. And he was talking about the give me five rule. And I'll sometimes implement this with newer clinicians and or techs because I want them to be part of that whole team. It's by the time you're done working with someone, even if it's for 10 or 15 minutes, I want you to know like five things about them. And so I can walk up to tech and I'll be like, give me five, and they will hopefully be able to rattle off five things like specific to that person or that patient. And it really helps just that interaction and with the therapeutic alliance a lot, which drives outcomes big time.
Yeah, I really like that. I think it's amazing the difference when your patient walks in that second visit and, you know, like you said, Mark and or Drew, you point out something about their kids or ask them about how that event was. And I think, you know, as we get into the flow of a day, it gets really challenging. But actually creating a process where, hey, you got a notepad or something, or even you put it in there subjective, just so that you remind yourself to circle back on that for the next visit. You know, half your job's done right there. All of a sudden, you've got some ability to buy in there too, which is really helpful. So along that same line, you know, one of the things that I was thinking of is, I think when I was a new grad, I would go into each evaluation with, oh, what, you know, what's the referral say, or, you know, what's their paperwork say? Like, I'm gonna try and figure out what the diagnosis is. The referral says upper trap strain, so, you know, I'm gonna make sure that I go in with that mindset and be proven wrong from it. And I think I've just kind of challenged myself on that, to where reviewing paperwork's important, but really trying to pull back kind of on the blank slate more, because I think you get so much value out of the first couple minutes of conversation with this patient. Because as you said, belief systems are going to be important. What do they hold value to? And then obviously there's many times where patients are going to be able to tell you exactly what's going to make them better. And if you just ask the right questions there too. So that said, patient that you're having trouble connecting with in the evaluation, what's maybe a go-to question or two that you guys can think about to really unlock that and be able to get the direction that you want to go for getting the outcome you want to go? I'll let Mark start off.
I usually try to make it like person specific, meaning like usually I'm asking about what their goals are, like what do they want to get back to doing. And normally that'll open up the conversation of like, okay, like, oh, you want to get back to walking in your neighborhood. Okay, tell me about your neighborhood. Like, do you have a dog? Like, you have someone you walk with? Like, that just gives me a segue into something that's going to be very salient to them. And I think there's a lot of value in that. There's probably also value in having like a icebreaker question that you can kind of just give to anybody, but I try to make it as person specific as possible.
I do love a good icebreaker. But yeah, no, absolutely. So good specificity around what their goals are. Like, obviously that's going to be really important. And then now next time you see them, you got at least one of those objective measures you can go right back to in terms of, are they making progress?
I don't know if I have a great answer to that specific question, but I have an interesting follow-up. I think what Mark said, when you start asking those things, I was probably going to say something about goals as well, but when you start asking, you know, what does it look like? It reminded me of when you're talking about behavior change, and say somebody says, oh yeah, I need to go to the gym. I'm going to go to the gym. If you as like a provider say, awesome, tell me more about that. How are you going to go? What's the route you're going to take? What time are you going? The more specifics they have around it, more likely they are, like by a huge percentage, that they're actually going to follow through on it. So the more you know about that patient and those specific things that do make it more salient, if they can actually see themselves doing it, that can be a really good way to get them to maybe do something a little bit more at home, or make a lifestyle change, or do whatever it is that they want to, so you can help them achieve those goals as well.
Cool. Yeah, I think that's really helpful. You know, and all the things you guys are alluding to. Yeah, I was thinking about this the other day when the most frustrating answer that you can get for a follow-up visit from a patient is, it's the same, right? And so when you either get that, you want to make sure, do I have the right question to ask? Like, how are you feeling? Are you doing better? Drastically different than, hey, how was picking up your kids this week? How was it playing pickleball? Because what we see is a patient could be 3, 4, 5 visits in, and you're seeing marked change, but the patient doesn't realize it sometimes because they want to be here. And so if you're having these soft skill conversations, you're really being able to help show them, like, hey, no, you're making progress. Like, this is where you should expect to be. And so I think getting the specifics around that, as you said, Drew, also being able to work towards the lifestyle change, really, really big component of that. So very cool. All right, guys, appreciate your feedback. As always, appreciate the soft skill communication. Hope everybody learned a little bit. And until next time.